Atrial fibrillation is a very common heart rhythm abnormality. It increases in frequency dramatically with age, and so age is probably the primary risk factor. Having any other type of heart disease also increases the risk. So if you have valve problems, or if you've got heart failure, or have had heart attack in the past, or some congenital forms of heart disease, also increase the risk of atrial fibrillation. There are also some environmental things, and other risk factors. So having high blood pressure over a long period of time increases the risk of atrial fibrillation. Having obstructive sleep apnea increases the risk. We think that and this has been a recognition of that connection just over the past decade or so. Alcohol is a big player. Both chronic alcohol use of greater than 2 or 3 drinks per day, or binge drinking, are both associated with increased risk of going into atrial fibrillation. There's actually a term for that called the holiday heart syndrome, where individuals often on New Year's Day or after other holidays would present to emergency departments in atrial fibrillation related to increased alcohol use. So there are a number of causes, but in most individuals, we don't find a specific treatable cause. One exception is elevated thyroid hormone. So when the thyroid is producing too much thyroid hormone, or if somebody who's receiving thyroid treatment is getting too high a dose, that can increase the risk for atrial fibrillation as well.